Going back to what you said about the elderly, I'm uneducated in this field, but like the followers, I know that they are very curious to know certain things. Like the question I did before, when you have elderly people with already a huge list of medications they take on a daily basis, does the vaccine collide?
No.
Are they vulnerable?
No, with some exceptions. What you get when you get a vaccine, you basically get a solution of usually saline. There's traces of certain harmful elements which are part of the manufacturing process, but they're in trace levels, less than you would get eating a slice of a portion of swordfish. But you do get an antigen. So basically a protein, ideally it should be pure, which then the immune system reacts to. However, the fact that your immune system is driven into hyperdrive, it's like you are getting infected, but milder. If you are vulnerable, you're taking certain medication, yes, there may be an issue. However, if you get the infection, it's going to be worse. So the whole point of these vaccines is, look, if you're at really low risk of getting the infection, you have to worry about the adverse effects of the vaccine. If you're at high risk of the infection, the risks from the vaccine are much lower. And this is a general rule. The general rule is that the adverse event rate is usually the same across various ages, with exceptions. With the COVID vaccine, myocarditis, it was much higher in the younger. But usually, your adverse event rate is more or less stable. However, your risk of infection, your risk of getting a disease varies with your age. And the classical example is COVID. Why? Because COVID, you are much more likely to die. I mean, most children and most young people who got COVID didn't even get any symptoms whatsoever. It was that mild. It was like a cold, or even milder. However, in the elderly, because their immune systems were weak, the virus tended to spread more. And then when eventually it kicked in to kill the virus, it would have to destroy all of these infected cells. And the impacts of that caused like a hyperimmune reaction. And that's what killed you. Many of the people that died were basically because of the immune reaction. And in fact, steroids were one of the mainstays of treatment for the elderly in hospital with severe COVID. However, the vaccine, basically, the benefits are limited, in my opinion, these days, these boosters. Those over 65 who have never had COVID-19. And there you still have an argument for some benefit. And I think Vinay Prasad agrees with me, and I think Bhattacharya does as well, and I think most of the, nowadays, public health authorities around the world are limiting these vaccines only to the elderly at risk. In fact, recently, the United States, they've stopped giving it to children, which is, better late than never, I would say.
Unfortunately, time is up. I don't know if you have one last comment, Ivor.
Yeah, it was just flu was mentioned and flu vaccines. So it's funny how whenever an engineer looks at the actual real world outcomes, you find completely different than often the trials or the assumptions that people believe. Just a real quick one. In JAMA, I think it was 2006, there was a big study done by NIH looking at the actual real-world effectiveness of the flu vaccines. And they went back 25 years from when 5% of the elderly got the vaccine up to currently at the time, I think it was 65 or 68%. And they did a proper analysis for the first time, corrected for confounders, and they found astonishingly and shockingly that there was no mortality benefit over the 25 years of flu vaccines. And you might wonder, well, why don't we know that? Well, it was covered on Australian national television and a few main media outlets. But after a short bit of panic, it just went quiet. And to this day, it has not been challenged. So what we see from the medical and the pandemic industry is one thing, and what we see in the actual data of what happens in the real world is diametrically opposite. So it's very interesting, isn't it? I wonder why.